I could not interact socially, that I just stopped talking to my friends. My life became absolutely impossible to live.
Her mental state had deteriorated rather shockingly. She became involved with very harsh arguments with my 91-year-old mother.
I lost my children 3 times. My family didn't want anything to do with me. I lost everything. Lost friends. My whole life was gone. It was all about the drugs.
I used a lot of opiates and dangerous. So that's when she called. I know for a fact if my mom wouldn't have Baker acted me, I would have died. Maybe not that day, but it was coming.
Whether you call them demons or disorders, these are just some of the conditions that affect more than 57 million Americans each year, drawing them into a downward spiral that not only affects them, but everyone around them, around us, their families, friends, co-workers, employers, their community. For some people, there's a fine line between living and having a life. While emotional and mental illnesses among children, adults, and seniors are not rare, finding a place this dedicated to treating them is.
Most people don't understand what a community mental health center is or who receives services, but we treat approximately 20 to 30,000 individuals and their families in any given year. And we treat anyone who comes to us. We are a nonprofit organization. We don't turn anyone away. We're open 24 hours a day, 7 days a week.
We are LifeStream Behavioral Center. We give people the help they need to understand their problems and work together to find solutions so they can really live their lives again. LifeStream is where hope comes to life. A Danish philosopher and existentialist, Kierkegaard, stated that hope is the passion for what is possible. But hope does not magically manifest. Hope must be brought to life. At LifeStream, more than 500 caring, compassionate, and qualified people in 52 different programs are passionate about bringing hope to life for those in need throughout Lake and Sumter counties. And for the nearly 1 in 4 Americans with a mental disorder, there's much to be hopeful for. When diagnosed and treated properly, recovery rates for mental illnesses surpass the treatment success rates for many other physical illnesses, including heart disease. Think it couldn't happen to you or someone you know or care about? Mental health and addiction disorders are diverse and cut across all social, cultural, economic, and ethnic backgrounds. Those battling schizophrenia, bipolar disorder, depression, anxiety, and drug and alcohol addiction find success through therapy, medications, or a combination of both. Throughout LifeStream, we are demonstrating that hope is possible for the asking. Yet nearly 2/3 of all people with diagnosable mental disorders still don't seek treatment.
I was put into rehab, court-ordered 3 times before I did hope and recovery on my own. I knew that something was going to end up happening if I didn't stop. And my kids helped me see that. Like finally that they were worth more than the drugs.
I went from being dysfunctional as a human to capable of interacting socially and speaking and talking and relating, and the things that humans do, just the normal basic things that humans do. I couldn't do those things, and once I met Dr. Valente, once I got on the right blend of medications, I slowly was capable again.
Stigmas surrounding mental health services still discourage those in need from seeking the help they deserve.
Every day I deal with stigmas, not just seeking treatment, but then providing treatment. Denial, lack of understanding, lack of awareness, or even the concept of where do I go to get the help I need. We all know where the dentist is. We all know where our primary care doctor might be, but people don't know where to find appropriate mental health treatment usually.
At LifeStream, we don't judge problems, we solve them. Whether our clients receive care through inpatient, residential, outpatient, or case management programs, we go to great lengths to deliver that care in a comfortable environment with dignity and compassion.
I'm really appreciative now for LifeStream. And with my daughter, they're doing parenting classes, they're doing family groups, they involve children, which is awesome, because I thought the whole time, oh my gosh, 4 months, I'm not going to see my daughter, but they care about you, they really do.
Give it up over there, humanity! Give it up!
LifeStream offers numerous programs throughout our community, beginning with a proactive approach to education aimed at prevention. LifeStream's 24-hour access center is where people can either call in for an appointment or come to the facility to be evaluated for admission to the appropriate level of service. Our behavioral and substance abuse services are tailored for adults, children, and seniors, and classroom environments for those challenged by the traditional school settings.
Lake County School Board is a great partner for LifeStream and Lake Academy. When I look at Lake Academy and the benefits that we have, these students, in most cases, don't feel like they're part of society as a whole. They don't feel like they have a place. What we provide for them is that self-worth, to show them that they have a place in this world and they are an integral part of what goes on.
We bring our commitment to hope, our passion for what is possible, to as many as 4 generations at any given time across our region.
Mental illness not only affects individuals, it affects their families, their extended family, their workplace, wherever they touch. The illness of mental illness touches also.
Mental illness doesn't discriminate. That's probably the beauty of it, is that we're all equally vulnerable. The downturn in the economy, the last decade of life in the United States has been extremely stressful for a lot of people. If you are a workaholic and we take away work from you, that's going to be a problem. The same way if you're an alcoholic and we take away alcohol from you.
Whether addressing mild or severe and persistent mental illnesses or addictions, LifeStream empowers individuals and families with the education and treatment they need to achieve recovery and resiliency today and for the future. Now we're empowering you. What if you could help break the cycle of mental disorders and deadly addictions? What if even the most modest commitment on your part could have a profound impact on not just one person, but for that person's entire community? You too can bring hope to life.
People need to be aware of the fact that you don't have to wait, that you can start treatment early. And bringing someone in for an evaluation or an intervention doesn't doom them to lifelong treatment. It doesn't mean that they're going to be sick their whole life. The earlier you intervene, the better. And more importantly, for parents and for providers out there, the sooner someone understands the concept and the need to get treatment, the better they will be. We all know that providing appropriate mental health treatment reduces the cost of care for any patient. Patients' physical health gets better when their mental health is better, and that's not rocket science, it's pretty clear. LifeStream's concept of where hope comes to life is the concept of being able to enlighten people. Many people, when they're sick, don't really know where to go, they don't know what's wrong, and in that moment it's pretty scary, it can be fairly dark and confusing. Treatment is available, there's a light at the end of the tunnel.
If I had not been made aware of LifeStream, I feel that the authorities would have been involved. If my sister had had to be incarcerated, it literally would have been life or death with her.
I'll do something for you.
I'm going to be able to take care of myself. I'm going to be able to live the life that I want to live. I mean, I've still got dreams, I've still got hopes, I've still got things that I want to do.
Being clean and sober and being a mom that I'm supposed to be and a daughter, it's wonderful. Like, I wake up every morning thanking God for the beautiful day.
Life today is great. Being in here, I've started laughing and loving my life, which that wasn't normal for me. I'm playing sports again. I feel good, I feel healthy, I'm taking care of myself a lot better.
When you put your hand in a flowing stream, you touch the last that has gone before and the first of what is still to come. Leonardo da Vinci.
I am Kevin.
I am Lisa. I am hope.
I am hope.
I'm Holly, and I am hope.
I am hope.
I am hope.
I am John. I am hope.
I am hope.
We are LifeStream, and together we are where hope comes to life.